Have you ever felt your heart sink when you noticed your baby had a fever? It's one of the most stressful moments for any parent. A fever can make a baby irritable, fussy, lose their appetite, or even seem more sleepy than usual. It's impossible not to worry. But here's something important. In most cases, fever is not the enemy. It's a sign that your baby's body is fighting an infection. The challenge for parents is to keep the baby comfortable while the body does its job. In today's video, you'll learn 7 safe and effective ways to reduce your baby's fever without putting their health at risk. These are simple, practical tips recommended by experts, and they can bring quick relief and peace of mind for the whole family. And pay close attention. By the end of the video, I'll share a very common mistake parents make when their baby has a fever and why it can actually make things worse. But before we start, don't forget to subscribe to the channel, hit the like button, and turn on the notification bell so you won't miss any important tips about your baby's health and well-being. Now, let's understand what fever really is and why it happens. Fever is one of the most common symptoms in childhood, and contrary to what many people think, it is not a disease by itself, but rather a defense mechanism of the body. When the baby's body detects viruses, bacteria, or any foreign agent, it raises the temperature to make the environment less favorable for those invaders. This means that fever, in many cases, is actually a natural ally in fighting infections. However, fever can also cause discomfort and worry, especially since babies can't explain what they're feeling. It's important to know when fever is a normal response and when it needs more attention. In babies under 3 months, any fever above 38 degrees C, 100.4 degrees, is a warning sign and must be checked by a doctor right away. In older babies, moderate fevers can sometimes be managed at home, but if they are very high, persistent, or come with symptoms like extreme sleepiness, trouble breathing, or seizures, medical help is necessary. In short, fever is a sign that the body is working. Parents' role is to monitor, keep the baby comfortable, and see the pediatrician when needed. When a baby has a fever, one of the biggest risks is dehydration. Fever makes the body lose more fluids, especially through sweating and faster breathing. That's why keeping the baby hydrated is essential for recovery. For babies under 6 months, the main source of hydration should be breast milk or formula. Besides fluids, milk also provides important nutrients and antibodies that support the immune system. For babies over 6 months, you can start offering small amounts of water in addition to milk. If the baby has already started solids, water-rich fruits like watermelon and orange can help, always with pediatrician approval. Keeping the baby hydrated helps to regulate body temperature, reduce fever discomfort, support the immune system in fighting infection. Signs of dehydration include dry mouth, fewer tears when crying, dry diapers for many hours, and unusual sleepiness. So, offering fluids regularly is one of the safest and most effective ways to help a baby cope with fever. Giving a lukewarm bath is one of the safest and most effective ways to help reduce a baby's fever. Warm water helps regulate body temperature and gives quick relief from discomfort. The bath should be lukewarm, never cold. Cold or icy water can cause shivering and even raise the body's internal temperature, making the fever worse. Keep it short, about 10 to 15 minutes, just enough to cool down and calm the baby. Make sure the room has no drafts, and dry the baby well right after the bath to prevent chills. Bath time can also be a calming moment. The warm water helps the baby relax, and gentle words or cuddles can make the experience even more soothing. If the baby is too fussy for a bath, you can use warm compresses instead, placing them on areas like the forehead, underarms, and the back of the neck. In short, a quick lukewarm bath is a safe and effective way to refresh, relax, and relieve fever discomfort in babies. Lukewarm compresses are a simple and effective way to help reduce fever, especially when a baby doesn't tolerate baths well. The gentle warmth of lukewarm water helps regulate body temperature gradually, bringing comfort and relief. Compresses should be applied to key areas such as forehead, underarms, groin, back of the neck. These areas have more blood circulation, making them respond better to gentle cooling. Avoid using cold or ice packs, as the sudden temperature change can cause discomfort, shivering, and even raise the body's internal temperature. To prepare, soak a clean cloth in lukewarm water, Wring it out well and gently place it on the baby's skin. Re-wet every few minutes to keep the effect going. This method is simple, safe, and can be repeated several times throughout the day. It helps reduce irritability and makes the baby feel more comfortable while dealing with fever. In short, lukewarm. Compresses are safe, easy to use, and a great extra tool to help your baby feel better during fever. In some cases, even with all the natural care, a baby may still feel uncomfortable with fever. In these situations, medication may be needed, but only under medical guidance. The most common medicines for babies are acetaminophen, paracetamol, and ibuprofen. Ibuprofen only if prescribed by the pediatrician and depending on the baby's age. The dose must always be based on the baby's weight and age, never a one-size-fits-all amount. Never give medicine on your own or use leftover prescriptions without consulting a doctor. The goal of medication is not only to lower the temperature, but also to relieve discomfort. A baby might have a mild fever and still feel fine. No medicine needed. Or have a moderate fever but be very fussy. In this case, medicine may be necessary to improve comfort. Warning: never give aspirin, acetyl salicylic acid, to children, as it can cause a serious condition called Ray's syndrome. In short, medicine can be an important tool, but it must always be used responsibly and under medical supervision. Although, fever is usually the body's natural defense. There are times when it may signal something more serious and needs urgent medical care. Seek medical attention right away if the baby is under 3 months old and has any fever above 100.4 degree, 38 degree. Fever goes above 102 degree, 39 degree, in older babies. Fever lasts for more than 48 hours with no improvement. The baby has seizures, extreme sleepiness, difficulty waking up, or trouble breathing. There are skin rashes, persistent vomiting, or signs of severe dehydration, like very few wet diapers. Parents should never hesitate to ask for help, even if it turns out to be nothing serious. Visiting the pediatrician provides peace of mind and prevents complications. Another important point: trust your parental intuition. If you feel something isn't right with your baby, even if the symptoms don't look severe, seek medical advice. In short, fever is often temporary and manageable at home, but certain warning signs require immediate professional evaluation. Now, I want to hear from you. Every parent has gone through that moment of worry when their baby has a fever, and each family finds its own ways to handle it. What was the most effective way you used to relieve your baby's fever? Was it a lukewarm bath, compresses, hydration, or medical advice? Share your experience in the comments. Your answer may help other parents going through the same situation and give them more confidence to handle it. Remember, sharing experiences is one of the best ways we can all learn together. We've reached the end of our video on 7 safe ways to reduce your baby's fever. We've seen that fever is usually a natural defense mechanism, but it requires attention and special care to keep your little one comfortable and safe. Simple steps like keeping your baby hydrated, dressing them in light clothes, giving lukewarm baths, using compresses, keeping the room cool, ensuring proper rest, and using medication only under medical guidance can make a big difference in their well-being. Now, I invite you to subscribe to the channel, hit the like button, and share this video with other families who also need this information. And don't forget to comment below with your favorite strategy for dealing with your baby's fever. Remember, this video is for educational purposes only and does not replace medical advice. Always seek professional care if you're unsure or if symptoms persist. Caring for your baby's health can be challenging, but with the right information and lots of love, it becomes much easier.